Hi, I'm Dominique Edwards. I own Edwards Psychiatry here in Seattle, and so happy that you're here. I know it can be really hard to reach out for mental health care. Sometimes even the word like psychiatry scares people. So glad that you're here, and I'd love to tell you a little bit more about what we offer and how we can help. We have a whole team to help you out and focus on medication management, but also coaching techniques for ADHD. We can also talk about like integrative solutions that don't include pharmaceuticals. So we are very open to kind of just meeting you where you are and assessing kind of what condition you have and kind of taking it from there. And we do so for kids as well as adults and teenagers. So we have a pretty good breadth of who we're able to serve, and testing would be available for ages 6 through 60. We help folks with ADHD, or if you are kind of wondering, do you have ADHD? Maybe you've gone like your whole life without getting clarity on that. Maybe growing up, culturally it wasn't accepted or it wasn't even mentioned as an option. And so we are happy to help kind of look at the atypical or more like creative cases that may have gone unnoticed, or if you have recently been diagnosed, we're happy to kind of really take our time and go through your options and talk about different ways that we can help. And we really prioritize spending time with our clients, not rushing appointments, not just kind of throwing something together. We want you to feel comfortable and like it resonates with you in terms of a diagnosis. And we also really prioritize keeping in contact in between sessions, so that if you have any questions about maybe a new medication that kind of feels off, or maybe like you're wondering, is this a side effect that's normal? We really want you to reach out and contact us, and we will get back to you for sure on what to expect and kind of help ease some of the anxiety of starting a new medication. And we especially love working with people of color or like the LGBT folks. It's my passion and priority for you to feel safe and welcome. I really pride myself on having a clinic where, you have representation and someone who looks like you and has been through similar experiences, because it matters for healthcare, and we are honored to be able to be that person for you. Also at our clinic, we are really skilled at kind of differentiating between like anxiety, depression, ADHD, and kind of clarifying like maybe, the anxiety that you've been feeling is related to being overwhelmed with all these thoughts running through your mind. And some patients will say it sounds like a radio or like a track kind of constantly going, train tracks. So we really enjoy like taking complex history and parsing it down to see like, was it ADHD all along, or was it maybe like an atypical presentation? So that is something that we also enjoy doing. So if this sounds like you, then we'd love for you to reach out and book a free consult, completely, low commitment, no pressure. We'll just talk about kind of what brings you to services and how we can help. So the process would be you just sign up for a free consult, and then once we kind of talk about what you're interested in during that same consult, towards the end, we'll give you plenty of time to ask any questions, and then we will book your first session if you're ready to move forward, which would include just kind of filling out our introductory forms. Then we'll meet for about an hour or so and talk about your entire history, make sure we thoroughly cover everything, and then we'll talk about a treatment plan together. So would love to hear from you and really appreciate your time watching this.